of York Region Public Health. This partnership work, of course, is so very important and valued, and we collectively recognize that importance of bringing the experts to you, as Shireen mentioned, for that continued capacity building in our communities. The Transportation Equity and Justice Speaker Series, as you've noted over the last few weeks as well, has provided a space for sharing experience, knowledge, and for discussing how we can support that traveler safety and equity piece in our communities. I work as a public health nurse in the area of built environment and health, and this work aligns with the work that's happening here. And of course, my role is to support improving community health and well-being, reducing inequities, and reducing transportation-related injuries through the safe mobility work alongside all of our partners in transportation. So on behalf of CIFAL York, we welcome you all here. We hope you engage and enjoy the session, and please participate in the Q&A so we can continue the conversation. Thanks, everybody.
Thanks a lot, Tia. And now I would like to introduce Aisha Saintiche. I hope I'm pronouncing the name correctly. Aisha will be the moderator of this session. Aisha is joining us from York Region, and she is a certified health coach and the founder and owner of Metumau Health, with over 15 years of experience in mental health, accessibility, and diversity and inclusion. Aisha has used her experience as a strategic advisor and health coach to understand the complexity and intersectionality of the mental, physical, emotional, and spiritual barriers that keep people from achieving their optimized health and wellness. Aisha also holds masters in public policy administration and law, as well as certification in change management, advanced crisis intervention, and counseling and health coaching. Thank you so much, Aisha, for accepting the invite to moderate the session. And now over to you to start off the session with the introductions.
Absolutely. It is a pleasure to be here this afternoon in the middle of the week. So thank you very much, Shireen. So to kick things off, because I think it's going to be a really incredible conversation, I would like to start with introduction of our speakers, both Robyn Brown and Ana-Francisca de la Mora. By reading their bio. So Robyn Brown is the lead of the Toronto office's real estate, economics, and planning team, as well as a member of IBI's placemaking group. As a dedicated professional, her project work is geared to giving clients the best advice possible. Her work transcends a broad spectrum of real estate advice, including highest and best use studies, disposition strategies, economic development strategies, growth management, market studies, feasibility studies, community services and facility studies, economic impact analysis, demographic analysis, and related skills. Prior to joining IBI Group, Robyn worked in commercial real estate, specializing in industrial leasing, land disposition. Robyn has a BA in political science and an a master's, in history from the University of Toronto, along with a master's in planning from Ryerson University. She's involved in a wide range of external organizations, including the Urban Land Institute, including their Women's Leadership Initiative and Mentorship Committee, is on the board of directors for Toronto Crew, and is an active member of BUILD. She has proven to be an excellent and effective IBI Group ambassador. Robyn is the ultimate team player, inspiring and pushing to think creatively and proactively. And then we have Ana-Francisca de la Mora, is an architect with almost 20 years of experience with a focus of global transit architecture and transit-oriented development. She has participated in large transit projects in Latin America, Saudi Arabia, and in Canada, including TYSSE Finch West Station, ECLRT Keelsdale, Station, Vancouver Broadway Subway Station Extension, and currently the Yonge Subway Extension as a technical advisor. Her work is characterized by her commitment to making healthy places that are accessible and inclusive. She's a member of IBI's Inclusion Council, serves on the steering committee for IBI's Global Women's Network, and is the vice chair of Toronto Society of Architects. She's also a Women's Leadership Initiative champion for the Urban Land Institute and a fellow member of the Royal Architectural Institute of Canada. We are absolutely joined by two incredible women, and I certainly hope that we all take advantage of what is about to be shared today in today's conversation. And so I want to turn it over to our speakers to lead us into a great conversation this afternoon. Thank you.
Thank you so much. I realize now I need to edit my bio. Obviously, our communications department sent that as very long and very braggy. So I'm gonna work on that, although that's not always the worst thing. So I'm just gonna share my screen here. and we can start off the discussion. Okay. So thank you so much. I'm really pleased to be here and with my colleague, Ana-Francisca, and I think this is such a great and important topic. And I am going to be talking about transit inequity in the form of inclusionary zoning. Inclusionary zoning is a policy that is used across North America and is really relatively new to the city of Toronto. And the idea is, how do we allow for affordable housing around transit investment? So I have a small agenda, sort of why we're here today. I think really this discussion is shaped around two very important things. The city the region are investing substantially in transit right now. And also we have obviously a very, not new, we've had a affordability crisis for some time. And these two things have really come together. And this is an address of sort of how do we make equity happen with transit investment. So I'm going to talk about what is affordability, because I think that's a really contentious topic. The paradox of transit-oriented development, where Toronto is planning their transit, housing growth and affordability, inclusionary zoning, what are major transit station areas, and some issues around inclusionary zoning, or IZ as I may occasionally call it, and then also some discussions about how this fits into the larger topic that Ana-Francisca is going to cover, which is transit equity and design. So, where are we today? Obviously, we've got a substantial housing crisis going on, not just from a supply perspective, but also from a cost perspective. I think we've all seen the headlines, $1.2 million for the average resale house in Toronto. One bedroom rent is just over $2,000. And the CMHC, which is the Canadian Mortgage Housing Corporation, is estimated that we need 3.5 million more houses in order to achieve affordability, and we'll discuss that a little bit later. And really what are the fundamental problems is median income has grown by 30%, and that's overall, and that's really kind of hitting some of the high marks. And the price of owning a house has grown 131%, and it's about a little less for rent, but it's still a very important thing is that people just don't have as much money and prices are constantly going up, which I think we all know. And it's important to see these sort of graphs. So here you can see sort of the difference between the rental and how this has incrementally grown over time. So defining affordability. There's a lot of different ways that people define housing affordability, and this is a bit of a problem because when we talk about affordability, we should be defining it. The Canadian CMHC defines it as a percent of your income spent towards household expenses or shelter. So that includes heat, hydro, and one might include internet or cell phones, but also your rent. And the province, however, defines it by percentiles. And so what we have here is sort of what is considered the household deciles or percentiles. And so you see here, this is the group that earns, $1,300 to $30,000. And what you see here is increasingly as the income goes up, you've got far more owners because obviously they can afford that. So this is one way that we can define affordability. The city of Toronto, in doing their inclusionary zoning, has defined it a bit differently because they want to focus on sort of a group of people that are sort of in the middle of incomes that are struggling because they don't qualify for subsidies, but they also can't afford housing and rent at the market rates. So right now what they've done is they've sort of put together some bands looking at the type of people that would be working in these jobs that would create these incomes and what kind of a rent they can afford. So you can see here that up to $70,000, these people can only afford $1,700 in rent, and that is less than the average rent for a one bedroom. And this is household income. So this means families too. So you're looking at a good chunk of our communities, if you look here from sort of 5 down, that cannot afford the average one bedroom apartment. So this is obviously a huge problem. We've known about this for some time, and it's finally we're attempting to address it. So of course, I'm going to transit over to transit and say, okay, transit-oriented development, we talk about it, we think it's amazing, it is great, we're investing in transit so people don't have to rely on cars, you can live in a community that is built up around transit, but there are some paradoxes to transit-oriented development, because investment in transit can also lead to displacement, because as transit investment comes, this can raise the value of land, it can raise rent prices, people are displaced due to construction. And so what this really does is it impacts the local community, and then who is going to actually benefit from the transit? As the transit is developed, new groups come in, rents go up, and then those who actually need the transit the most to commute to their jobs, to move their families around, may not be living near it. And so it's a huge problem. So a couple examples that we've had in the city of Toronto, and I think Eglinton Crosstown has been a really interesting example for the community of Little Jamaica, and how that was sort of mishandled, and how negatively the impact of the construction affected an entire community and the vibrancy of a community and local businesses. Another example sort of I think that many people have learned from is the community of Weston in Toronto, again, a lower income community, which has received some investment through Go Transit and the Up Express. This community was able to learn some lessons and was able to get involved from some of the beginning of the planning and making comments about the kind of things they wanted. They wanted a new grocery store. They wanted to ensure that people weren't going to get displaced, that rents weren't going to go up. They wanted to shape sort of what happened to their community when transit came in. And Lawrence Park is another example where Lawrence Park community, they really got involved, and they said, we want Metrolinx to help our young people learn through apprentices and trades so that they can get jobs. And so they're actually working on these programs and on all the construction of the Metrolinx project. So here is, a way that what traditionally could often push people out and create inequity is increasingly being seen through an equity lens, and the developers of transit, cities are starting to understand that this is a really important thing. And so we're starting to see a real change in how transit-oriented developments is impacting cities. So obviously Toronto has a lot of transit projects going on. I think we all know from construction. We've got a number here. We've also got a lot in the larger region. Hamilton has a project. Durham Scarborough is getting a BRT. So you've got a lot of different projects going on and some existing ones. But the question is, who are these serving? This is a map, and this is unfortunately 2016 data. I don't have the 2021 data yet. And this looks at sort of how much the average household shelter costs. So the dark green is, is the people who it's the highest, but these are also the highest income, versus you have some of the areas in Scarborough and Etobicoke, which are very expensive to live in. But when you look at the transit plans, they're over here and over here, and they're not really getting the transit. So these are probably the groups that need transit significantly. So housing growth and affordability, obviously the city has a number of programs. They understand that affordability is an issue. And there's sort of a continuum of how we address housing affordability. And it starts with emergency shelters, transitional support housing, long-term care, social housing, affordable rental, affordable homeownership, market rental, and market homeownership. So basically the city of Toronto is saying that they need another 40,000 affordable units in order to meet their action plan in the next 10 years. And this is both rental and affordable ownership. And so what they've done is one of the tools that they have through the Planning Act and through, which is a provincial bill, Bill 109, which is more housing, more choice, which is done by the PCs, is the implementation of inclusionary zoning. This is a market-based mechanism that is designed to require new developments in strategic market areas to afford affordable housing as part of their development approval process. And I want to be really clear on this continuum of different types of housing. This is the affordable rental housing and the affordable home ownership. This is not emergency supportive social housing or long-term care. This is in these other two categories. So what is inclusionary zoning? Inclusionary zoning is essentially to tap the gains from rising real estate values, so with the investment of transit, in order to create affordable housing for lower income families. And the idea is this shares the benefits of the infrastructure investment, because the infrastructure investment is tax dollars. And so it's important that this gets shared in the benefits of it. So what this also is trying to do, as I said before, when people got displaced because of their transit investments, what this also looks to do is provide more transportation access to a wider socioeconomic group. So this is going to provide moderately priced housing, both rental and ownership. So you see here in this example, this is the same building, and they say, okay, well, there's no affordable units. So what the inclusionary zoning does is it'll offer a bit more height and density in order to provide additional affordable units. So in this case, they've raised the building another story, giving it another 16,000 square feet of space. So that's about a 14% density bonus. And what they got out of it is 60 market rent units and 6 affordable units. So this is basically increasing this and allowing for 10% affordable units. Now it's only 6, but it's a small building. So it's important to understand that. But this is the idea of it, is they give a little more height because it's a side transit, which is a great idea. And they give the density bonusing, which then allows the developer to provide more affordable housing. So what is Toronto doing? Toronto is what they're going to do is going to identify protected major transit station areas, where developers going to see 1,000 units. And what they want to do is dedicate 5 to 10% of condo units to be affordable in 2022. This will start in September, and it'll increase incrementally. So every year that number will go up. So it'll go to 8 to 12, and it probably will max out, depending on the neighborhood, about 20. And the idea is that these will be affordable for 99 years. So that's a huge issue, is like, you can't just provide affordable housing and then someone sells it and it's gone from the affordability. This needs to be maintained, because if we don't maintain it, we're just continually going down in the number of affordable units. So it'll be a 99-year affordability. The 99 years is a bit of a legality thing regarding whether people can squat on the rights and eventually become owners of it. So that's why people use 99 years on land leases. There's going to be also transitions, though, because there's a lot of developers that already have their buildings designed and built, and they can't just come in and say we need 10% affordable housing, because they're not designed like that and they can't afford to do that. So there'll be some transitions within it. And Toronto is specifically addressing this low to moderate income housing, so about $32,000 to $92,000 a year. And I know that 92 sounds pretty high, but when you look at that chart I showed earlier, these are people that could barely afford a 1-bedroom at $2,000. So this is sort of to help these groups out. And these are also households, these aren't individuals. So this is a household income. And the idea is that this would help families. So Toronto is identifying these major transit station areas and primary major transit station areas. And these are about 500 to 800 meters within a planned or existing major transit station. So this is like an LRT, a GO station, or a subway. These areas within the cities, and this is the cities across the GTHA, are planned to accommodate a substantial portion of residential growth and employment growth. Each of these stations was going to be planned for a minimum number of jobs and people per hectare. In the case of a subway station, it's usually about 150 people and jobs per hectare. But in the case of some areas like downtown, Yonge and Eglinton, and other urban growth centers that have transit, it can be upwards of 400 people and jobs per hectare. So right now, the city is delineating these areas, deciding where they're going to be, and then categorizing them for the most opportunity. So when you delineate it, you take the station, you do a little circle around it, and you identify the areas that could be included in it. This is a map of the region of Peel. This is the Peel's MTSAs that they're considering. And essentially it's looking at, in this case, what areas have the potential to be redevelopments, that's in the yellow, that'll be impacted by the station. Some places can't be redeveloped because it's single family homes and that's sort of a long-term thing. But this is sort of showing where's the potential that we could be putting in new high density housing and include inclusionary zoning in here. So these groups and these developments will have access to the transit and provide affordable housing as part of it. So I'm gonna be honest, there's some issues with it. This is new and it's just going to be starting in Toronto in September 2022, ideally. The administrative complexity. Who's gonna run these or own these units? Because you want them for 99 years and it's a condo and all these people are individual owners. Who's managing this? Who's going to decide who gets these units? Who's going to monitor what the rent should increase? Who's going to monitor what is affordability? That has not been dealt with appropriately yet. And there's sort of talk about bringing nonprofits and organizations in. But I think we can all say that Toronto Community Housing has in the past not always had the capital to look after their projects. So the other question is who maintains these projects? Who keeps them in good repair? Because you don't want these people to have buildings in units in buildings that are, aren't on par for the rest of the neighborhood. So who's going to maintain them? Feasibility and development. Some people look at this and they say, well, not all markets make this feasible, and that's really true. So one of the things the city is doing is they are looking at different areas and deciding whether they have a viability and what percentage it is. So this isn't going to be like a universal policy in many ways. Each major transit station area is going to have sort of their own policy, and that's going to tell you the level of affordability that's going to be coming in here. Another context, not all MTSAs are good. Some of them just don't have the density or the existing land uses of the ridership potential, or, you know, they're serving a very affluent population that may not be using these transit stations. So this is an example by Humber College. You know, there's a lot of green here, which is non-developable. You've got a very stable neighborhood, very low density homes, but you also have a college. So, you know, in many ways, it's going to drive a different type of ridership. So not all stations, and I think we can all think of subway stations that have very low density, that just aren't going to be able to provide these kind of densities or the inclusionary zoning. The other thing is we're going to talk about is incentives and exemptions. What is the impact of inclusionary zoning on rental housing? So if you're building a rental building and you're including affordable units, it's a long time to get payback on a rental, purpose-built rental unit. So how do we have to incentivize those groups that are already providing rental housing, you know, in order to do that? Development charges or levies that are put on homes to pay for growth-related infrastructure. So in many ways, you're already paying for this infrastructure. They can be substantial. They can be $40,000 a unit. And when you're trying to provide an affordable unit, how do those impact that? Another exemption will be mid-rise buildings. So these are units with fewer than 100 units. So some of the smaller buildings where, you know, at 10%, what are you going to get? Like 1 or 2 units? Is that really the best thing? Or are they going to be giving option for offsite levies where you can donate money and we can build something offsite? There's issues with that because you don't want to stigmatize a group and you want to be in the same area. So there's issues with that, but it's something they're doing. And also phase-ins, like as the development goes up, can we get more units out of the things? So many cities use exclusionary zoning, so it's not new, and we've got a lot of great examples from other municipalities. New York City has a mandatory program, and they added 1,500 homes or units in their first year. You know, I think there's a lot of differences between the programs, whether it's offsite, on-site, the geographies, but this is something that's done, and it's quite common. I think there's like almost 1,000 municipalities in North America that do inclusionary zoning. Alberta does it. Vancouver has a similar example. Toronto's just getting on board of it, and really it's just to capitalize upon this transit infrastructure to provide equity, to provide affordable housing right around transit stations. So I'm going to slightly segue into what Ana-Francisca is talking about, which I think will just sort of kind of lean this in. I think the idea is that, you know, I think it's really important to understand that transit isn't gender neutral. And the underrepresentation of women and racialized people's perspective in transit planning has very negative impacts on where transit goes and who it's built for. Transit infrastructure investments are not equitably spread out. They are not done by need. And if you look at that map I showed you sort of earlier, and this one, you notice everything goes downtown to Union Station. Well, that is not where a lot of jobs are, and particularly lower income jobs are not going there. It's also what's rush hour. Rush hour is business hours, but for many people who have lower income employment, who work at the airport, who work at factories, the subway doesn't run when they're working. So, and we've made a lot of these decisions about where we put stations based on a certain perspective of where people are going, how they're getting there, and what their jobs are. And I think it's really important to think about when we're planning transit is understanding, you know, who are we planning for and what are we doing? So a few takeaways: understand transit connects people and resources to opportunities. Consider who benefits from transportation projects. Transit is obviously tied to health and environmental equity. It's very important to engage with all the members of the community who are impacted by transit, whether it be it's coming to their neighborhood or they're not getting any, and making safety, equity, and accessibility a lens for future transit investment. I provided a few resources here. I don't know if we're going to be sharing this, but, and of course, I'll be happy to take questions. I think we're going to do that at the end. Sorry if I spoke really quickly. I was just trying to get through everything. Thank you.
Thank you so much, Robyn. I do hope that was an incredible conversation, presentation. I do hope everyone was writing down their questions, because as Robyn mentioned, there will be a Q&A portion at the end of this, but I would now like to turn it over to Ana-Francisca de la Mora to bring her conversation to the table. So thank you.
Thank you, Aisha, and thank you everyone for inviting us to give this talk. As per the bio, I am Ana-Francisca. I am an architect and passionate about transit design. So I'll speak about transit based on a gender lens and with the interest of making transit better for everyone, not only for women. Because when we try to understand things from a different perspective, then we can understand and make better choices for design. So let me just share the screen. Okay. Share here. I'm going to make it full screen. Okay. So I assume people can see this full screen. As I said, looking at the woman's perspective, just as we want, we could look at it from different perspectives. And today I'm going to focus from a woman's perspective with the interest of how could we see it and make it better for everyone. There's different sources that we did this research. This is not only myself, but several people in the office. We are an interdisciplinary team throughout, also with transportation engineers. So we use sources from the USA and other offices in London and India. So where I'm going to go, why is this important? How do women travel? We'll speak about the pink tax. Some of you may be familiar with that. A summary of the dilemma, what this represents for transit agencies, and some of the solutions, and then continue with this conversation with your input. I will also have some interactive moments, so please type your answer in the chat, and that way it feels like we're almost in person. So when you're traveling through an underground station and you find a space like this, tell me, how do you feel in a space? If you're in a transit station, and just type in one word or two, how does this space make you feel? You can type whatever comes to mind first. When you look at this image, Robyn was saying that she feels anxious. Richard again says also anxious, concerned, uneasy. And no wonder, because of the lack of visibility, doesn't seem to be enough light. It seems like it's a neglected space, and immediately doesn't put us at ease. So that's where, as designers, we come in, and also the maintenance and operations of a station like this. And if we like graffiti, some people find it exciting, then let's make it more intentional. So the reason why this is important is because statistically in Canada, as in a major city, surprisingly, women make the majority of the transit riders. And much because of necessity and being part of the lower income bracket. They represent 5% of the workforce and 24% of the transport workforce in Canada. So when we can apply this lens, we can serve more than half of the population better with transit, and also stimulate our economy. Females make fewer trips, but they are shorter, and they make more use of the transit overall, as I was mentioning. They make most of the population, in this case, like in transit, is more than half, 54% in the Greater Toronto Hamilton area.
I've already been outside, so I better not see one piss bottle.
Okay, so when in the interviews and part of the research we looked at, when you ask women what is their biggest barrier, men have different answers. It's too slow, it doesn't know where to go, it's more of the practical. But women, our main concern is you don't feel safe. When you're a woman alone, traveling alone, it's the main concern. Sometimes you feel like it's a target. People will approach you more. So that feelings of anxiety, it doesn't help to give women mobility, and it doesn't help the purpose of transit, which is to have more people to have to use and enjoy our cities. We want to give the same opportunities and again to contribute to the economy. So when we look at the reasons of riding in transit, it's for females, it's because they don't have a driver's license. It's expensive, they might not have access to a vehicle. So with more reason, it's an incentive to have transit facilities that accommodate women and other minorities. So how do we travel as women? And this is not only for women, but think about the last time you travel on transit, not carrying a purse or package. Think if you can type the last time you think you did not travel with a purse or a package. Has anyone? Maybe you can type on the chat, what type of package do you bring when you're traveling? As women, we always have a purse. Yeah, we always travel with something, with a backpack, even with a portfolio, or pushing a stroller, a cart, an extra bag for our computer, especially now that it's more mobile. So Riley was saying sometimes only during trips where I was going somewhere to pick up packages and groceries. So thinking about this, yeah, never. We always travel with something. We always make up a point of having an extra bag for anything we can carry. So most women, they are observed to always have a package or traveling with someone. They're bringing a kid for a class, taking a family member for a doctor appointment. And with this, it's the need of additional space and also to avoid barriers, in this case, a step as opposed to a ramp. So when we think of also how women travel, not only with that additional need of the space, it's also about the trip chaining. We drop off the kid at a class, then in the meantime, we run an errand, we visit someone. All these short trips add up. And because women as homemakers are responsible of the bulk of these domestic responsibilities. And that adds up when it comes to the fare system. If they have to pay for a full trip in every time they get on the transit, they will not be able to afford it. So they reduce the number of trips. Again, they reduce the number of activities they are able to engage with. And that has a domino effect with many other things. And of course, if we want to motivate people to use transit, let's make it more accessible. Another important point is that when women report most incidents, but they don't report a lot of what happens. And it's hard when you are reporting to a phone as opposed to the full presence in person of a staff member, where you can relate what is happening. And I'll come back to this later, but it's also not only reporting, but to be informed that what you reported had an effect, even if it wasn't you, but of others. So when we hear in the TTC, when you hear something, say something, yes, okay, I can say something, but how is that reflected? And if we create an awareness that things are being taken care of, then people will continue to report. Eyes on the street are very important, and eyes on transit in this case is essential for a sense of safety. So let's talk about this pink tax, which I briefly mentioned, but we call it the transit pink tax. So let's give context to what this means. Pink tax is that extra amount of money that women pay for specific products or services. Sometimes you'll see it as price discrimination or gender pricing. So what items have you found in your everyday life that you're paying more just because it's for a female? In this case, here's an example of two identical helmets, And just because the one on the right is for female, because it's pink and it has different figurine, it's actually, I don't know how much, $13 more expensive, but it's in fact the same product. So tell me, what items have you found are priced higher just because they are for women? You can tell me on the chat. Women's razors, yes. Dry cleaning, another one. Haircuts, yeah, hair products, they can be exactly the same, but when it's for women, same thing. Any others you can think of? Clothing, yes. I even find even for footwear, clothes that are gender neutral in general. Sweatshirts. Yeah, and it's just because it's for women. Shoes, yes. And sometimes it's justified, but a lot of the times it makes you think, why am I paying more for exactly the same product? In transit, it works in a different way, but just to give you an idea, women pay in general 42% more. If you want to buy a product, you're paid 42%. The number of incidents is 42% more, which is quite high. And what does that mean in terms of transit? We know that the fare is the same for men or for women, but I'm talking of a little bit beyond that. Every time we have to change, and that loss of time waiting in between all these different errands from one stop to the other, that means we're losing time, and that means we're losing money in our economy. So that every time we transfer, that's an additional cost. And when we arrive, and sometimes it's 9 o'clock at night, it's dangerous, and we have to compensate with an Uber to feel safer. That last mile between the transit stop onto our house, that's additional money. So that's what we call the pink tax in transit, this additional cost that women have to accommodate in order to do their task, which is often related to homemaking and many different errands during the day, as opposed to someone else in the household that goes to a job between 9 and 5. So that's, now that we know the dilemma, transit agencies don't find themselves with not having enough money to have to accommodate everything. And I'm not talking only of LRT and subway and bus, but also airports and trains and other type of facilities that give us mobility. There's competing priorities. They have to consider all passengers neutral, but they are not, as Robyn was mentioning. The boundaries, where is the boundary of the transit agency and where does the one for the municipality? There's this constant debate. And also the leadership is mostly male and may not be able to focus on needs that they haven't felt how to develop it themselves. So let's talk about some of the solutions. So let's talk about 4 main approaches. First, bring awareness. Then second, to have that inclusive engagement. Then planning and design. And then the 4th, about monitoring, improving, and reporting. So we are all be part of that solution. In terms of awareness, there's several advisory committees and gender awareness. For instance, the gender-based analysis GBA plus assessments that now exist during design. So it looks at the design process from a gender perspective. And several of these advisory committees have started since the 70s and 80s precisely to bring this awareness. So the way the audit works, and ideally has to start from the start. So there's consultation and the training, then there are the audits, they're able to compile some comments, and then there's concrete actions on the specific steps. So for instance, in my case, when I'm developing a design, the drawings are audited and they point out a few things that can be improved, and I have to respond to those comments. And that's when the conversation starts and we engage, and then throughout the construction, and then continues to operations and the maintenance of this facility. Inclusive engagement, well, to include more the presence of women operators and to be involved in all phases of the design, from the construction, the maintenance, and the lifetime of these fees, and to be inclusive. I know we're focused on women, but I'm talking, why not? It's obviously of all different perspectives. Also, design principles. When we start to make sure we have the design principles and prioritize those that are most in need. For instance, in this case, having adequate lighting or the next bus information panel. When we know how long is going to take the next bus, it's very empowering, and you know, either you stand there waiting and you may feel unsafe, or you think, okay, I have 20 minutes. I'd rather not stand here by myself. I'll stand elsewhere, or I'll go and come back. Information is key. When, for instance, the TTC has implemented a few successful programs of designated waiting areas where there's additional lighting, and you know that when the train stops, there will be a live operator that can be able to see you. Also on buses to request stops, little details like that make a big difference. In Mexico, there's assigned cars for women, and this is not the only part of the world. Also, when it comes to the planning of stations, when we have clear sightlines, we allow to work with other disciplines to have ample spaces that can tell you where you're going. So you don't have to rely on signage. You intuitively know where you're going, you know who's coming in, you feel there's eyes on the street, not only for you, but you can provide it for others. Also, animation of spaces. A tile of one color is the same cost as a tile of another color, so why not make them memorable and animated? So it when something feels scared, something feels intentional, you take ownership, and it also allows for that taking care of something that belongs to everyone. It's not only about the stations, but also the first and last mile. When you feel the least safe is when you exit the station and you're walking from there to home. How are we going to provide that sense of security when we're walking to, especially in this case, the one where women feel the least safe, and also for men, it's pretty high, is for parking structures. They're lonely, the light might not be very good, there's a lot of hiding spaces. So it's not only about just the transit portion, but the experience all the way to your door, to home. Transit-oriented development, it allows you to have many things in one single place without having to commute to several places and lose time. It's very popular with the new generation. I don't know what about you, but my kids don't. When I was younger, I wanted a car, they want a phone, and they want access to different options for their mobility. And to have everything in one place is something they value a lot. So I think with the new planning of providing the mobility right where you also live is where it's going in the right direction. Planning and design, obviously, when we are thinking of providing larger spaces, some step-free signage, visible areas for elevators, the seating configuration, so we can apply for different types of mobility needs, push buttons, and wide corridors. Easier first systems, so they are easy to use and allow for fair capping, so you can transfer several times, and also there's a maximum amount. So women can be as efficient as they need to within their day and their daily chores. And the one that I was talking about, well, to monitor, improve, and report. Whenever there's something happening, to provide that maintenance, surveys, and monitor, and communicate the results. If we're able to tell the transit riders what has been improved, then you become a participant and owner of that public facility, because you know if you see something, you can actually do something. Final thoughts? Well, there's a to-do list for everyone here who is involved in building cities. It's the design and develop of policy development, so we're better informed, and we have clear understanding of the passenger needs. we're able to provide better services that are safe, secure, and accessible. Also, to keep in mind of having a better gender balanced workforce. So this comes naturally when there's many different points of view at the decision tables, and to show the results, to communicate. Thank you very much, and back at you, Aisha.
Thank you very much, Ana-Francisca. Sorry about that. I want to thank you for the conversation. There are some questions that have come up in the Q&A, but certainly just listening, I think you've absolutely both broadened, right, the perspective and understanding around transit. I think when we think about transit, we think we just need to get on, get off, but you have both certainly broadened that perspective and really looked at the experience, right, of very different individuals when it comes to transit, right, and that intersectionality of like the actual experience, again, beyond just ridership. So I'm going to start with our first question, and I'll start with you, Robyn, just because it was an area that you did touch on. So the question is, people with disabilities experience longer wait lists for accessible housing options. How have they been considered within inclusive zoning, and how is this compounded, especially within areas where transit stations are still awaiting retrofitting for increased accessibility?
Yeah, honestly, again, I think this is a place where inclusionary zoning hasn't quite dealt with all of the issues. I would say that's definitely in the sort of outstanding things. I think family size units and accessibility. I will say most buildings are accessible. New buildings are deemed accessible by their own nature. So the idea is that all of the units would be accessible no matter what. So I think that will benefit, but how they're prioritized, and I think that's my concern about who's running it, how are you choosing the tenants, what's this list, who's going to organize it? And that's the thing, is there's some discussion about prioritizing certain groups. Is it based on just an income level? Is it based on another type of need? Is it based on accessibility? And that really hasn't been decided. And I think that's a bit of a blind spot in how we're going to actually make sure that these units get out to the community and sort of, and it's hard because it's like, who's the most deserving when we know there's such a backlog. So I would say that, first of all, the buildings are accessible just by the nature of their years of construction. As for the retrofitting, about 4 years ago, I was in an accident and I spent quite a while in a wheelchair, and it was an incredibly eye-opening experience for me about how little accessibility there was even in our own office building. And yes, it is. I couldn't go to certain stations because I knew I couldn't get out of them. And that is something that really needs to be addressed and addressed quickly. And it's not, I know there's a backlog, but that's just, I mean, that's just a human right.
And I think that also touches on something that you spoke about earlier around how are we engaging, right? How are we engaging people in early conversations so that we don't find ourselves having to retrofit or having to say, okay, you know what? We need to go back and make these changes. I think that's something that you both touched on really eloquently around the importance of engaging with those who we, you know, if we want to increase ridership, then we're actually going to have to engage with those communities and those individuals who we desire to be taking, you know, public transportation. So thank you for that, Robyn. So we have a next question. It is, we need co-op housing. None presently exists in my community. CMHC, the province, banks, and credit unions should provide the loans, and publicly available land near transit should be made available for housing co-ops. And there is a reference, I guess, to a USA reference around that happening. It says, please comment. So I'll give both of you an opportunity to comment, but I will go with you first, Ana-Francisca.
I mean, co-op housing, I think this would be better for Robyn.
Okay.
Yeah, go ahead, Robyn. In terms of, I think we agree on the co-op housing, and you were looking at options to be able to maintain them.
Explore, yeah.
Sure. I know that there was an influx of co-op housing in the 70s and 80s, and some of the loopholes of the funding of that have changed. So I think it's quite difficult I haven't seen any new co-op housings in a long time. The City of Toronto does have these sites called, I think they're called open doors, and they're city-owned sites that are designated for affordable housing. Co-ops, of course, are private, like nonprofit boards. So the city can provide the land, but then there needs to be an organization to maintain and monitor. And this is again that problem with, you know, how are we, who's going to be administering this thing? I don't know that the city knows how to fund those things. And I think it's really kind of, it's a partnership between many levels of government. And I think it's something that they need to be pushed on, because you're right, the city, Metrolinx, they're the province, they own a lot of land in the City of Toronto. They're one of the largest landowners in the city, and they have lots of parcels, and they should be doing, they shouldn't be selling them for profit at this point. They should be building things for the community on them. And they have not always done that. So I think it would be really worthwhile is sort of saying, here's your station areas. If you have land in this, you have skin in this game, and you should be, you know, providing the things you say that you want in these stations. And maybe they offer their land as their equity stake in order to help fund it, because land in the City of Toronto is incredibly expensive. So that's a huge starting point there. But frankly, I'm not as familiar with the co-op model. I know that there's a legislative reason that some of it has sort of dwindled. And I know that existing co-ops have changed. So I'm sorry, that's not my specialty.
No, that's not a problem. I mean, I think what this demonstrates is that there's quite significant complexity, right? When it comes to, again, just mobilizing, mobilizing and creating equity in this place. We know that there's a lot of moving parts. And certainly what it, again, I emphasize what I think you both have brought to the table around the importance of dialogue and really making sure that we're doing our due diligence in all areas to make sure that it is as inclusive as possible. I do not see any more questions. I know we have quite a few people on the call. We have 2 experts. I certainly want to, you know, the last thing we want to do is end this conversation and someone says, I should have asked the question, right? It's the speak now or forever hold your peace. I want to open it up to anyone who has any more questions or comments. I
want to add a little bit of what you said, Aisha, in terms of listening, but also imagine being on that person's shoes. Like Robyn was mentioning, you know, I had the experience of being on a wheelchair. And I remember having children and having a stroller, and it changes your perspective. So when you are trying to think of designing something for housing, streetscape, a transit station, think of what would be like to be that person. When you've been sick, you all of a sudden you realize like just a small barrier, a step, a staircase becomes a huge barrier. So that idea of putting yourself on someone else's shoes brings you even an additional perspective. So it's not just a guideline, but how would it feel if you are not fully welcome? How you were that space that was dark and graffiti, and you can even smell that it was dingy, was not taken care of, immediately then can make you think of the solutions.
Yeah, no, absolutely.
As opposed to wait for the guideline to come and then you apply it. Start thinking, force ourselves to think from that perspective.
Absolutely. And I think that, again, kind of goes back to what Dr. Gould mentioned, right? So as you were talking about, again, the women experience in transit and then thinking broadly, like, again, someone who's traveling with strollers, if you're a caregiver, like all of these different aspects that we don't necessarily take into consideration that would have an impact on our actual accessibility or inclusion in this space. So I do love the idea, again, of kind of putting yourself in someone else's shoes, or at least thinking beyond even our own lens, and looking at the potential of someone else's experience and what that could look like in this space, right? So I see no more questions. I also see Shireen and Ali have popped on. I don't know if they have anything to bring to the table before I officially turn it over to them and thank our amazing speakers this afternoon.
Thank you, Aisha, and thank you, Anna, and thank you, Robyn. I have a couple of questions, if I may. First question is for Robyn. Thank you, first of all, really great presentation covering affordability in housing, especially focusing on Toronto. In the new policy or policies around, are they actually taking also a closer look into gender aspect of housing affordability, or to what extent this is also looked at in your perspective and what you have observed so far?
Yes, there has been some discussion on securing a certain percentage of the housing for single mothers, and guaranteeing that tranche that really requires it. I mean, I think the other issue is what size are these units? Like, it's great you give a woman with 2 kids a 1-bedroom at a condo, like that's not helping. So it's also about providing, because the other thing is like the calculation is on gross foot area, so it's a percentage. It doesn't necessarily mean they're going to be 2-bedroom units, but they should be able to provide. It's also not just giving them an affordable place. It's going to be an affordable place they need to live and has the access and the types of things they need to live in. But yes, there is a discussion on sort of using some of these spaces to transition people out of the shelter system, or people who, you know, are struggling, you know, with sort of unstable housing. But again, who is going to be making these decisions, I think, is still an unknown, in my opinion, because you need someone to administer this, because you ultimately, it's a small resource and you're going to be giving it to people, and you need to make sure that it is getting to the people that are going to have the most benefit from it, or there's some equity in how you sort of dole out this thing. And I would say that probably the lowest income groups of people in Toronto or in the GTA are women and racialized minorities and single family households. So I think that, you know, obviously that group is going to qualify just from an income perspective alone. They're probably going to be the largest percentage of people that I'll be looking at. But there is some discussion about designating a certain amount specifically for women. I'm not sure the mechanism, again, of how they're going to identify those women, how, you know, that's done. So.
Thank you very much. And next question, if I may, is for Ana, and that's thank you very much. It was really interesting to see different examples of gender-based transit project activities. In your view, what I'm looking at is, say, if I want to take students or experts to some of, or at least or one of the best projects that has in our area, or wherever you can suggest, that has considered all those gender-based elements, particularly focusing on the needs of women in transit. Do you have any particular project or design implemented or in process that we can showcase or consider as best practice in what all those criteria that you mentioned? I hope I was clear in asking this. It would be nice to know what would be the best practices that we can go and take a look at it in our area or any other place you suggest, recommend. I mean, there are certainly elements of some of those in most projects, but if there is one or two projects that in your mind are the best, that would be nice to know. Thank you.
Well, projects are flooding in, and obviously I'm biased because we've done a lot of projects, participated in these projects, but being located at York University, the Toronto-York subway span extension included a lot of, did not cut costs by, it was one of the examples of Finch West Station that is well animated with color. The example at York University by Foster is a beautiful station of creating an event of getting into a subway station. So all those 6 stations are good examples of good animation and good design. The gender-based analysis, now it's more, it's a recent implementation on RFPs. But still, that has, those 6 stations have good architectural elements and good bones in terms of the functionality, because it's, yes, they're beautiful stations, but also when we say good bones in transit, it means that you are taking from one mode to the other efficiently and in a very short period of time. You also want your commute to be as effective as possible. There's also examples of the Mississauga BRT on how the experience of going from grade and taking the bus and the lighting systems that were used. Well, soon to open the Eglinton Crosstown. A lot of the efficiencies and many of the new guidelines from the city were implemented there to make it accessible, not only for different types of mobility, but also for to be able to that it's adapted uniquely to each context, even though there is a consistency. There was a balance of being consistent with the whole line for identity, and also its adaptability for the different needs of each neighborhood, because it's crossing many different types of neighborhoods and contexts. So that's another example. And then, for instance, the Viva BRT. Those stations are so well equipped with so many different systems and heating. I think that one of, in terms of bus rapid transit, that those stations are looked around the world for the way they interface with the street and the facilities that they are providing for different types of needs by the passengers. And I think I should stop there, but yes, and it's exciting what keeps coming and what's happening and the different debates. More and more people are involved in transit. I like when it becomes personal, because yes, I like when people are getting involved and want to have a say on where their entrance is, where the door would be located, what materials they want to see, the amenities. So exciting times in our city when it comes to transit, because a lot is coming.
Thank you very much. Great answers.
All right, so I think if there are no other comments or questions, we can conclude. I would like to thank Robyn and Ana so much for the great engaging presentation. This was really, really helpful, and I'm sure participants also enjoyed it. I would like to also provide special thanks for Aisha for moderating the session. And by now we can conclude the final session of the Transportation Equity and Justice Series, which I believe a lot of other discussions would come off with, but this was really great. And thanks a lot for all participants for their time and for engaging in the discussion and throughout the series. And hopefully we'll see you all again in our upcoming events. Thanks everyone, and of course special thanks to Dr. Ali for all the organization and support throughout the arrangement. Thanks everyone.
Thank you.
Thank you, Sherry. Thank you.
Thank you.
Right.